I did 3 years of pulmonary fellowship, and yet asthma, I'm more nervous about talking
Really?
than. Hi, my name is Dr. Goyal. I am a family physician here at First Primary Care. I am trained as an internist as well as a pulmonologist. So asthma can actually start pretty early in life, but it can also be an adult onset asthma. And usually the symptoms of asthma are cough, shortness of breath, wheezing, inability to exercise to your full capacity. And sometimes those symptoms, if severe enough, can lead to even respiratory failure requiring hospitalizations and even intensive care unit admissions. Untreated asthma can actually lead to significant issues. As a child, asthma is one of the most common reasons which makes kids skip school. Common cause of frequent visits to the doctor's offices. And unmanaged and uncontrolled, over time it actually leads to decline of your lung function, which will impact your adult life, your capacity to exercise and a capacity to just do daily things. Uncontrolled asthma can also again lead to respiratory failure, and I've seen asthma attacks severe enough that need life support, and not caught in time can actually lead to death. So in direct primary care model, we again get to work with the whole family. So much of management of asthma is about understanding asthma. Education is very important. Education of not just the children, but the families. Education around understanding how asthma happens, because it's multifactorial. Genetics play a role, allergies play a role, viral infections that we get also play a significant role. So understanding where asthma comes from and what are some of the symptoms, how to recognize the symptoms early, and how to stay on top of it early rather than wait for it to get bad. So in our model, because of the excellent access our patients have and the time our physicians have to spend with the patients, we focus heavily on education, early recognition of symptoms, and early treatment. Diagnosis of asthma requires a test called spirometry. It's a test where you are asked to breathe into a tube which measures your airflows. And the airflow measurements give us an idea whether there is any obstruction in your airways, which is the hallmark of asthma. We have the ability to do spirometry for our members at no cost. And spirometry is valuable not only in the diagnosis, but sometimes also in evaluation of your treatment on an ongoing basis. Asthma medications can be a challenge because some of the asthma inhalers can be quite expensive. I have seen some of the more expensive inhalers that we have traditionally used in asthma now become generic, so in general the costs have dropped. But I have seen so many patients actually get their inhalers from Canada to save costs, because you can get an inhaler at 1/5 the cost as compared to America. And luckily, we've been able to help some of our patients who don't have insurance with some samples that we've been lucky to get our hands on. But in general, the treatment of asthma can be a challenge because of the expensive medications. And hence more a reason that understanding where the asthma is coming from and understanding what lifestyle changes you can do to manage it better, that becomes even more important. If you are ready to get comprehensive primary care and have a personal physician who is looking out for your overall health and not just bits and pieces, please go to our website at firstprimarycare.com and see how you can experience world-class healthcare.